You should stop taking Ozempic and talk to your doctor right away if you feel any of the following signs and symptoms. Lump or mass in your throat, difficulty in breathing, and difficulty in swallowing, because these may be signs and symptoms of a thyroid tumor. If you experience skin rashes, hives, or itching, the red, swollen, blistered skin, and wheezing, tightness in your chest or throat, difficulty in speaking, or unusual hoarseness, then stop taking Ozempic immediately and see a doctor, as these are signs of an allergic reaction. If you feel inability to pass urine, change in the amount of urine, and blood in the urine, stop taking this injection, as these are signs of kidney problems. If you feel there is sudden pain in the right upper abdomen, right shoulder area, or between the shoulder blades, and yellow skin or eyes, or fever with chills, very severe dizziness or fainting, stop taking Ozempic, as these may be signs of gallstones. You should also stop taking Ozempic if you experience fast heartbeat, vision changes, new or worse behavior or mood changes such as depression or suicidal thoughts. Severe and sometimes fatal pancreatic problems have occurred with this medication. Call your doctor right away if you experience pancreatitis symptoms such as pain that starts slowly or suddenly in the upper abdomen, pain that may spread to the back, which can be mild, or severe pain that may last several days, fever, nausea, vomiting, swollen or tendered abdomen. With Ozempic injection, low blood sugar may occur, and this risk may be increased if this medication is used with other diabetes medications. And you should look at the signs of low blood sugar, which include dizziness, headache, drowsiness or weakness, body shaking, fast heartbeat, confusion, hunger, and sweating. Call your doctor right away if you have any of these signs of hypoglycemia. Follow the instructions given to you if you have hypoglycemia. This may include taking glucotabs, liquid glucose, or certain juices.